Welcome back, guys. I'm Dr. Corbin.
I'm Dr. Madrano.
Today on Built for Medicine, we're going to talk about part 2 of top 5 mistakes people make when picking a specialty in medicine.
So the next thing we want to talk about is thinking that you have to be really good as a med school student when it comes to the skills in order to feel like that's the specialty for you. So first of all, a lot of people will tell you, a lot of attendings, and even they've done papers on this, the things that people really care about when they're looking at med students, things like availability, things like affability. The skill level is like the least of their concerns because that's what residency training is for. It's for building those skills. So don't feel like you have to be, the top performer when it comes to suturing in order to feel like, okay, surgery has to be the thing for me, right? Skill will come with time. It's does not mean very much at the medical school level.
Right, and to play off of that also, if you find that you're someone who's just not naturally dexterous, then picking a subspecialty where that is like the crux of how good you're going to be at it, maybe that shouldn't be for you. If you find that you're not able to pick up on small details with your eyes, of course, you'll train that with radiology, but if that's something you truly don't think you're very good at, maybe that's not the specialty for you. The next thing we want to talk about is thinking liking it matters most. This is a big one.
Yeah, it is. I think deciding on your specialty tends to be a very emotional driven decision that you make, right? And so naturally, the things that you really enjoy, the things that sort of bring you joy in the moment, those are things that you're going to be thinking, okay, that's what I'm meant to do, right? So I think a lot of students really get caught up in this, and they have a really good experience in this rotation, that rotation, and they enjoy it, and then they choose based off of that and just overlook everything else, some of the things that we're talking about now, right? Things like lifestyle, the hours worked, and all that stuff. You have to know all those things when you make a decision, and don't let the emotions be the thing that really drives your decision on choosing a specialty.
Right. One of the things we want to talk about is only exploring specialties you think you like or what other people like. This is huge. When you're picking a subspecialty, if you don't know what you want, then we suggest that you take each rotation, day by day in medical school, learn as much as you can, ask the residents, are they happy? Ask the attendings, are they happy? I used to do this on almost every rotation. I would ask the attending, are you happy? Point blank. And you'll be surprised. Some of the attendings who are in the wrong specialty will say they're not happy. Some of them said they love what they do and they couldn't imagine doing anything else. And then you ask, well, why? And the why is so important because if their why matches your why, perhaps you'll be happy too.
Mm-hmm. When I was looking at specialties, radiology was at the bottom of my list. I got little exposure to it in medical school towards like the first 2-3 years. And I decided really to explore radiology, take a rotation on it, because I had a close friend who was doing it and really enjoyed it and couldn't say enough positive things about it, right? And so I went for it, realized I really liked it, added more radiology rotations. So the thing that you ultimately think that you're not suited for or you don't like, it may be the thing that you'll ultimately choose. The only way it works out is if you give it a chance.
All right, last topic of the mistakes that people make when choosing a subspecialty. Only seeing the good and ignoring the bad. This is huge. What you decide, like me, at the very beginning of medical school, when you're younger and you're hungry for action and doing good, and you may not be exactly the same person as you finish medical school, as things in your life change, you might get married, you might have children, priorities shift. My advice would be try to pick a specialty that allows those changes to happen if that's what you care about. For me, it's always been important that I can give a lot to my job, but also to my family. And that's one of the things that I grew up with a loving, caring family. I want to be able to give that back. Mm-hmm. And some specialties allow that to happen more than others. And so it's important to not only see the good, but look at the trade-offs. Look at how much time you're going to spend in the hospital versus how much time you're going to be able to spend at home. Look at the financial aspects that are going to be allowing your family to do what you need to do to take care of them. Look at the exposures you're going to have, needle stick injuries that may or may not play a factor in, again, you and also your extended family's health. And look at the growth of the specialty. Things that you're able to do now, will you be able to do them in the future? Will you be able to do even better things in the future? These are all things you want to consider when choosing a specialty.
Those are really good points. I'll just finish with saying, you said this earlier, and I need to highlight it again. When you're talking to attendings, you can't just ask them what they like. Ask them what they don't like about their specialty, right? And some of the things you alluded to, a lot of medical students will just focus on the success. They don't think about the complications, right? The complication rates, the severity of the complications, right? What happens to the patient, like what harm can be done to the patient. And then how does that weigh on you as a physician going forward? Are you someone who can cope with stress and failure very well? Or are you someone who thinks, you had one bad complication and you're thinking about that for the rest of the week and so on? So definitely consider all these things.
We have plenty of resources to talk to and get you more exposure. If you like radiology, of course, reach out to us. We also have plenty of friends in other specialties too. Well, we say all this to say, make an informed decision, do what you like, do what you love, and with that, you'll take great care of your patients. We thank you, and if you found this valuable, please like, comment, and subscribe.